As you know, I have a on-demand associated with the Q bank to support the on-demand. I have over 2,000 questions, almost 3,000 questions. And those who've taken those questions, the Q bank, there's some areas that I can see the percentage is low. So I'm selecting them, making videos out of it. It may be difficult, but if you overread it, the stem of the question, you're likely to mix it. It's content-based. This is the first question. It's a content base, and it's very common questions you see you'll see it in an NCLEX. Which of the following teaching should the nurse include? That means teaching question. And this is teaching a client who's now post-aortic valve replacement, prescribed warfarin. I always say how to answer question. Read it from the back. Look for the asked, the case of the question, your buzzwords, rewrite them on your own and take ownership of the question and then use it to answer the question. I've answered the question already by selecting the buzzwords, right? What is the question? Which teaching you should include? What are the buzzwords? Aortic valve and then warfarin is a prosthesis. So patient has a prosthetic heart valve and is prescribed warfarin. Which teaching should you teach them? Use razor blade for shaving. So you want to use electrical clippers is better. This one you're going to bleed. Acetaminophen is better than any other NSAIDs. So that's the easy way if you have pain. Don't take Motrin or anything like that. Tylenol will be the best way. You should consult with your healthcare provider before taking antibiotic because antibiotic can either increase or decrease the effectiveness of warfarin. Soft toothbrush because you prevent the gum bleeding. You may need prophylactic antibiotic if you're having invasive surgery because bacteria can seed, go into the valve, cause endocarditis, and you have infection. You should call the ACP if you have flu-like symptoms. Infection can affect the activity of the warfarin, and so it can increase or decrease it. So that's one of the things you should include. So which teaching is better? Acetaminophen, call for antibiotic, use soft toothbrush. You need an antibiotic for invasive procedure and call the ACP, HCP. So those are the right answer. Razor blade is not. Next question. What personal protective equipment should the nurse wear when providing routine care to the client? There's a buzzword there. Routine care. No, every care, no change in dressing, nothing. And this is caring for a client confined with a confirmed diagnosis of TB. So if you have TB, it's airborne. What a PPE you need for airborne, N95. If you're touching the patient, yeah, you wear gloves, gown, and everything, right? But they ask you what kind of PPE is effective for getting rid of these organisms. For routine care, so routine care, you just need an N95. You don't need surgical masks. You may need gloves if you're touching them, glove gown and face shield if you're doing wound care for this patient. It's not standard precaution. So number 2 is the right answer. You see how the questions are straightforward, but it's easy to mix it. Which of the following is the most important action for the nurse to take before giving the medication? That means what actions would you take before giving this medication? And nurse is preparing to administer a dose of what? Enoxaparin to the client with what? DVT. Which action you want to take? Those are the buzzwords. I want to take this action first before giving enoxaparin. Look at it, medication. Enoxaparin. It look like heparin. What are the 2 things you should know about heparin? Heparin causes low platelet. And of course, it causes bleeding. Anybody with heparin will decrease heparin platelet level by 50%. It's called heparin-induced thrombocytopenia. So we check heparin, make sure platelet, make sure your it's not dropping while you're on heparin. So what do? Platelet count is better. Blood pressure, unless you're bleeding, X-ray has nothing to do. It does not affect your white count. So the most important thing is assessing the individual platelet. Like I told you, questions commonly mixed on my Q bank. Which of the following signs will be most concerning to the nurse? That means it's bad, right? A client is diagnosed with acute pancreatitis and is receiving IV fluid and analgesic. We're treating the patient, IV fluid and analgesic to take care of the inflammation. Well, if you have abdominal pain and which improve on vomiting, is because you have ileus. It's not worrisome. You have an increase in the client blood pressure. It's not a problem. The presence of jaundice in the client's skin and eyes. This is obstruction of the biliary system. You should not expect this to happen if it's normal. Temperature 99.1 is okay. So when you have jaundice, that means there's a complication associated with the um, pancreatitis, and that is the right answer, number 3. Patient has jaundice. Number 4. Which of the following factors should the nurse identify as modifiable? Selected apply. And nurse is educating the patient about what the modifier and the modifier risk factor for cardiovascular disease. Which one indicate modifier? This can be confusing. There's 2 types. There's modifier means you can do something about it. No modifier, that means you can change it. Which of these I can change? Your age is your age. You can change smoking by stop smoking. Your family history is your family history. You can't go away from it. But you can help with your blood pressure by exercising, avoiding salt and other things. Physical, if you don't exercise, it can cause a problem. So whenever they said modify means you can do something about it. Non-modify, you cannot do anything about it. So the right answer is 2, 4, and 5. 1, you cannot change it, and 3, you cannot change it. What action should the nurse take? A woman with rubella delivered a baby an hour ago. Baby has been delivered by a mother with what? Rubella. What action should the nurse take? This is very infectious. It's contagious. It can cause problem. We don't know how long Mammy had rubella, but it does not matter at this point. If I want you to worry about it, I'll pay attention. What would you do? I don't want the baby to get infected. If you get infected, it becomes septic. Inject the baby with rubella vaccine. This is a trap, right? Rubella, okay, vaccine is given together with MMR, measles, mumps, rubella, and usually between 12 to 15 months. 15 months is the best time to give it. So we can't give it to a newborn. It's a live vaccine. Giving the baby to a mother to ensure skin to skin. The mommy is contagious at this time. We can't do that. Send the baby to the nursery. Yes, separation is better. It's been an hour. Probably we'll warm the baby and we take care of the baby. Erythromycin is to prevent conjunctivitis. It has nothing to do with the rubella. So this is the right answer, number 3. What is the priority to involve in the care of this client? That means what would you do? Who we should involve in the care of this client? Client with what? Stroke, with ME paralysis. So you have stroke, one side of the body is in trouble, it's not moving. Shows you a facial paralysis and a non-productive call. This is the biggest problem. You have a facial paralysis and non-productive call. You can't clear your airway, and one side is weak. Speech therapy is going to help with swallowing speech. This is not the time. We got to figure out why you can even clear your cough. Respiratory status is very important. So we got to get them. Physical therapy deal with the gross motor, and then occupational is a fine motor. There's no fine and gross motor involved in this. We want to get as much as possible to prevent respiratory compromise. So number 2 is the right answer. This is interdisciplinary team. Which cranial nerve assessment is done when the nurse asks the client to what? Close their eyes tightly and look up. Test taking strategy, I'll show you. If it's difficult, don't worry, look at it. You close your eyes tightly and you look up. What can do that? What will do that? Optic nerve, as you can see, it does not do that. It does not involve in eye movement at all. When you close your eyes, you're moving your eyes and you're expressing, facial expression a little bit is involved. Oculomotor, move the eye, but it does not help with the closure of the eyes. Squeezing to close your eyes is done by the facial. Trigeminal is only for pain, right? If you get into trouble, you get the pain, and it usually involving chewing and another thing, especially on your face, right? It's a sensation of your face, not expression. So that's what trigeminal does, sensation of the area that is distributed. Unlike facial, involving expression and motor function, trigeminal is sensory. So 4 is the right answer. And the last one. A patient with V-tach who has a normal vitals is oriented to time, place, and person. So you are V-tach, all your vitals is normal, and you are awake and alert. What would I do? V-tach, that means stable V-tach. You should call the doctor. Do you do a CPR? Do a defibrillation or request a pacemaker? I give you straightforward answers that you will not mix it. Pacemaker. Pacemaker is used for what? Bradycardia. Defibrillation is pulseless V-tach. This patient vitals is normal, so it has pulse. High quality CPR, you push on somebody whose heart is dead. So the only person, anything the next you do is to call the ACP. It's straightforward, but they can change the answers, but it's the same thing. No pacemaker because we're not dealing with bradycardia. No defibrillation because we have a pause. High quality CPR, we have a pause. Therefore, what is left is to inform the ACP because patient is stable, and we have to inform it. Thank you for watching and good luck.